Hello there, my name's Dr. Alex Phoon. I'm a plastic surgeon from Sydney's Park Clinic Plastic Surgery. And today I'm going to be talking about neck lifts and facelifts and who is a good candidate for them. So the first thing to discuss is the difference between a neck lift and a facelift. So almost all facelifts have an element of having a neck lift with them as well. And the only real difference between them is the extension of the scar around the back of the ear. So with a normal facelift, the scar usually goes from the top above the ear, and then depending upon whether you're a male or a female, the scar will go around the inside of the ear here, and sometimes in front of this area called the tragus, and then tuck imperceptibly around the earlobe here, and then back up the back of the ear. There are some variations in terms of where the scar goes once it's behind the ear, and sometimes we don't actually need to go into the hairline behind the ear, but that's the most common type of incision that is done for a facelift. Now, a neck lift is pretty much the same incision. It usually starts a little bit lower down here, but usually goes around the ear as well. And that's done in combination with the scar just underneath the chin. And by performing the scar underneath the chin as well as behind the ears, we're able to tighten the neck. So who's a good candidate for a neck lift and who's a good candidate for a facelift? Well, I personally think that very few people are candidates exclusively for a neck lift, although there are some that I do just as a neck lift alone. The additional scar burden by having the facelift really isn't that much, so if there's any chance that my patient's going to feel like they need a little bit of the lifting as well at the same time with the mid-face, it's a neck lift and a facelift at the same time. Do you need to have a facelift? Nobody needs to have a facelift, of course, but certainly it can really help people feel as if their outside appearance mirrors how they might feel on the inside. There is only one real way to sort of address the looseness in the neck, and that really isn't with Botox or fillers. It's by tightening the muscular sling that exists between your neck and your collarbone. So the technique that Dr. Murati and myself do here at Park Clinic Plastic Surgery is usually called the Feldman corset platysmoplasty, which is a really long name, but basically involves this big long muscle that extends from your neck down. So that muscle is called the platysma. It's a really long flat muscle, and the pair of them sit underneath your jawline and can become looser with age. As things get looser, you'll get these things called platysmal bands, which are the loosenings in the neck. Now, what the way that we tighten this up is through this tiny incision just underneath the chin, which is around about 2 to 3 centimeters long. We can tighten up the muscle between here and here. Okay, by tightening up that muscle and then pulling it up from the side, you get a really lovely lifting effect that can help really accentuate the jawline. So if anyone would like to see some examples of our facelift and neck lift surgery, don't hesitate to go onto the website or onto Facebook, where you can see some of our before and afters. And if anyone has any questions at all, don't hesitate to reach out to us however you would like to, and we're more than happy to accommodate. I hope this helps. Bye-bye.